Because my office is
My office is always busy.
I'm with you.
I wear a sweater in my office even in the summer because the air conditioning is going like full or.
Yeah, well, it's
But
colder.
this is actually.
It's colder in my office.
Jenny, all the names aren't on there, you know, like I can minimize them, so we're not like. Yeah, just minimize all the, so we don't see those like 3 faces looking at us. Kind of thing. Just minimize them. Yeah, and yeah, move them and then minimize also, just so it's not like a whole.
That's your mom.
Yeah, she's nice.
She told me all sorts of stories.
Oh, I'm
Really
sure.
biased.
We're going to go ahead and call the meeting to order. It is 4:30. And Dr. Marker texted me and said he had a family emergency, so he will not be in attendance. It was fairly significant because otherwise he would not miss a Board of Health meeting. So agenda item number 2 is adoption of the agenda. It's recommended that the Board of Health members adopt the agenda for the July 20th, 2022. May I have a motion?
Motion.
A second, please.
Well, I would like to move to amend the agenda.
That's correct, during the discussion.
During the
So we
discussion, okay.
need to adopt the
Second
agenda.
then.
Thank you. Now it's time for a discussion.
Okay. Yes, I would like to move to include on the agenda a discussion of how press releases are sent and the circumstances under which they are vetted by the board.
How press releases are sent and vetted by the board.
Are you talking about all press releases that the department sends all the time? Because there's a lot of press releases.
Well, that's what we'll discuss, I suppose.
That's interesting.
Other discussion regarding that motion?
Again, I think to get that in the motion, you have to amend your motion, you have to amend your second. You can't just add, because your
Oh.
motion didn't include that originally.
Okay.
Okay.
My motion to amend, like we can talk about it. I think we should talk about it.
You have to amend your second.
I amend my second.
Okay, so the motion on the table then is to accept the agenda with the addition of a new business item. If I correctly got this, is how press releases are released and how they are vetted by the board.
Well, I said specifically how press releases are sent and the circumstances under which they're vetted by the board, but yep, same thing.
Same thing. Okay, terrific. All those in favor? Say
Aye.
aye. All those opposed? The ayes have it. Well, we have adopted the agenda and that new item agenda number 3 is approval of the minutes. It's recommended the Board of Health members approve the minutes of June 15th, 2022. Can I have a motion, please?
So move.
Second.
Thank you. Any discussion regarding the meeting minutes? Hearing no discussion, we'll go ahead and go for a vote. All those in favor of adopting the minutes, say aye.
Aye.
Any say nay if you're opposed? You guys have it, so we've approved the minutes. I'm going to yield the board president announcements and move directly into the health officer's presentation and report and turn it over to Dr. Bob.
Yeah, thanks, Heidi. Really not much new in the health officer's report. You may have noticed that I changed the format a little bit on the emergency preparedness.
Notice that.
I thought it might be helpful for you to see what we're looking for in terms of deliverables, what the expected outcome is, and what our expected timeline is. What we have historically done is just giving you June updates. I don't have strong feelings here about what we, the format. Obviously, this took up a few more pages, but from my perspective, it provided a little bit more understanding, if you will, of what these updates really related to. So if you wanted me to continue to report in this way, and of course I say me, it was really Harry Gilbride who did all this, then just let me know if you want to go back to the old way of just giving you the June updates and we can get all that in a paragraph. I'm happy to do that as well. Otherwise, within the rest of the report, most of the unit managers, unit directors are here. Really pretty much milquetoast this last month, not anything particularly out of the ordinary. You all have seen it, and as always, I'd be happy to respond to any questions that you might have.
What questions do the board members have about the report? And on the format for the emergency preparedness, very different. Obviously, the last reporting is like just a paragraph. I feel like that this gives a much better picture of what emergency preparedness is doing. So I appreciate the format.
I'd agree with that.
Yeah.
I liked it because it lays everything out so nicely. Plan, timeline, what's achieved.
Engineer, I love charts and tables.
I figured, John, it would be right up your alley, so, or down your alley here. So very good. Okay, we'll continue to do that, and actually, I think even makes it easier for Harry. And of course, we go over this on a monthly basis, and this is what we've been doing for a monthly basis.
Can I ask a question? Would it be appropriate to ask you questions about monkeypox?
I'm happy to respond to questions about monkeypox.
I heard that there was a case in Elkhart County, and so can you just tell us the latest?
Yeah, there's, you may have heard, I'm also in WSBT and WNDU. They've asked me yesterday. I had two discussions yesterday with them. So there has been no case for, let me take a step back. Monkeypox is a virus, same family as smallpox, completely different than COVID or other viruses that were used to, not completely different, but really not much similarity there in many ways. It originated and is usually seen in sub-Saharan Africa, but there has been an outbreak here within the United States. About a third of the cases have been in New York City, And most of those cases have been centered in the population of men who have sex with men. Here within Indiana, I do not get reports from the state of Indiana or from Indiana Department of Health on how many cases we have had within the state. The last I looked, I saw a report of 11, but don't quote me on that. I will know of reports of any cases within St. Joseph County, if of course they've been reported. There are no cases currently within St. Joseph County. We have had a couple of close contacts, and we have been notified about those close contacts, and our nursing team, as they do with any communicable disease or any reportable communicable disease, because monkeypox is reportable, will reach out to those close contacts and will follow them for a period of time. Individuals who are at high risk are eligible for a vaccine. The vaccine is a vaccine against smallpox, and it's FDA approved for smallpox, but it's not approved for monkeypox. Hold on a second. I'm getting my drugs and my vaccines mixed up. The drugs, forget about the approval for a second. It is approved for monkeypox, and I'll talk about the drug in a second here. But we don't have the vaccine here. It has to be procured from the Indiana Department of Health, and they then, if we have an individual who needs it, will send it up to us. And so we have had some experience with that vaccine for close contacts. Now, there's also a drug that's available to treat the virus. That drug was developed to treat smallpox, and in fact is FDA approved to treat smallpox, but it's not FDA approved to treat monkeypox. And so if an individual is infected and the decision is made to treat that individual, that drug will need to be procured from the federal government. The vaccine, if given, it needs to be given within the first 4 days for it to be effective. It needs to be given within the first 4 days to be effective, and there's no guarantee that it will be effective. Fortunately, the case fatality rate with monkeypox is pretty small. We don't know for sure with this particular outbreak what the fatality rate is. It's my understanding, the last I read, and this would be from the popular press, I've not seen it from the CDC, that there's been no case fatality within the United States. In sub-Saharan Africa, the case fatality with monkeypox, and there are a couple different clades of monkeypox, so you have to be careful here, but the case fatality rate in monkeypox has been anywhere from 0 to 10%, and the thought is it's maybe in the 3 to 6% range, but again, it depends on the clade or strain of monkeypox that you're talking about. And the fatality seems to be predominantly in, again, sub-Saharan Africa, in individuals with immune compromise or children, very young children. And so the mode of transmission of the monkeypox is through contact predominantly. The thought is that prolonged face-to-face contact could cause some transmission through respiratory droplets. One never really defines prolonged face-to-face contact, but I don't really know much about prolonged face-to-face contact that doesn't usually entail some sort of contact. And so it's that contact. And don't take this as gospel truth of what I'm going to say here, but we were all told, for example, that Native Americans were infected by blankets that were given to them by colonists that themselves were contaminated with smallpox virus. The thought is that monkeypox may in fact be the same sort of idea, that bedding that is contaminated with the scabs and the lesions of individuals who had monkeypox could then be a risk for transmission of the monkeypox to another individual. So that's monkeypox 101. I have never myself seen a case of monkeypox, but I'd sure be happy to try to answer any questions that you might have regarding it.
Is there any, at this point, are there any plans or to put out any sort of statement of what to do in case of monkeypox? Are you planning on issuing anything like that?
We have,
Or are you just, it's not here
again,
yet, so.
the press have contacted me a couple of times now,
Okay,
and I have responded to them.
okay. Can you share what you've said?
That was
Just
pretty
kind of
much-
what you said?
That was pretty much what I said. You know, when the media calls us, you know, they'll ask multiple different questions. And sometimes in a 15-minute or 10-minute interview, I think the interview yesterday went for about 15 minutes. They might get one soundbite or two that gets distributed to the public. It's always difficult to know what the press might pick up on. And there's a bit of an art to having such discussions. I follow Dr. Fox's lead.
You're much more colorful.
Yeah, it is true.
Do we have any other questions for Dr. Bob regarding the health officer's report?
So I do have a question. And again, this is in the Policy and Legislation Subcommittee portion of the health officer's report.
What page are you?
It is page 41. And it's a question about the press release from June 30th. And this is the specific question. In the press release, you shared definitions of abortion use in medical practice and applied them throughout the document. My question is, when the committee met, did they discuss and why did they decide to use the medical definition of abortion instead of the definition used in the Indiana Health Code, which is when the document's intended to be given to legislators?
Sally, you want to respond to that question?
So,
If that's okay with you.
we use the definitions used in medical terminology because the circumstances we addressed were findings of rape and incest were medical. And the Indiana Code certainly defines abortion also in light of the mother's circumstances as termination of pregnancy.
Okay, this is the definition from the code. Is this the one that you're thinking of? Abortion means the termination of human pregnancy with an intention other than to produce a live birth or to remove a dead fetus. The term includes abortions by surgical procedures and by abortion-inducing drugs.
Right.
Is that the legal definition that we're?
That also includes life of the mother issue.
Well, yes, but I guess the question that I had is that in here, so spontaneous abortion talks about life, loss of the pregnancy before 28 weeks gestation, commonly called a miscarriage. I don't think that's an abortion under the statute
It
because,
absolutely is.
no, because it
Are
would
you
just be,
questioning what a medical doctor
It
says when
absolutely
they
is.
when
Are
they
you
talk
questioning
about a
attorneys
spontaneous
about the law?
abortion?
well, here's the thing.
We use the
Absolutely, I
term
am.
spontaneous abortion all the
Excuse
time.
me, this has to be done in an orderly fashion.
Yeah.
We need to have a question on the table. If you have a question, right? I don't think it's appropriate for us to be debating definitions of abortion. I just don't, because there are different beliefs in the room and how your definition of abortion, a medical definition of abortion, I'm not sure that those two things shall meet. And I don't want to engage in this debate in this forum regarding the definition of abortion. If there's a question at hand, then we can talk about that.
Okay.
I mean, throughout the current, not anything that's written yet, that's would be coming up. Throughout the current code, there are references to, this one's particularly about an unemancipated minor that may not consent to an abortion unless the abortion is necessary to avert the pregnant minor's death or substantial and irreversible impairment of bodily function. That is acknowledging that abortion is necessary at times for the life of the pregnant person.
And with all due respect, I'm not debating that. What I'm asking is, what is an abortion? And
Abortion is termination of pregnancy. The word abortion does not indicate why. It doesn't indicate how. There's different ways to accomplish that.
but in the state code, it does indicate there's an intent element. I mean, with all due respect, I mean, this is a legal issue. This is like law school 101. We have a statutory definition in a state health code. And rule number 1 of statutory definition is that when you are interpreting terms in a code, you use the terms as they're defined in the statute. You don't use the medical terms, you use the legal term. And this is the legal term that needs to apply. I mean, my question is, this isn't written, this document isn't written for doctors, it's written for legislators, state lawmakers who are going to be considering changes to the state health code concerning abortion. And so when we talk about abortion and the possible changes that might be made, and in this case, we're asking for exceptions for life of the mother, ignorance, fatal fetal abnormality. It seems like we have to use the definition in the health code. I mean, it seems to me, I know this has to be the case because I spent a lot of money and I have a degree from Notre Dame that tells me that, from the law school, that this is the term that we need to use when we're discussing these things with the legislators. Because
So Ellen, if I could clarify,
Yes.
so the discussion that's on the table, the question that you have then is, why did the health department choose to use medical terminology as opposed to the definition that was proposed in the Indiana code?
well, it's the definition that is law in the Indiana code, and that is what presumably is the legislators' understanding of what an abortion is and what would be how they define abortion when they rewrite the code.
Oh, no.
But throughout here, it mentions abortion, the word abortion in the context of, throughout the code, in the context of life of the mother and different. So,
Well, but
also, here's the other thing that's very important. There is the medical understanding of what abortion is, and why there is so much worry and controversy is because there's the medical understanding of what abortion is. And if you're going to legislate about that, and it isn't just limited, there isn't just a definition of abortion, it's used in here as an exception for life of the mother in the current code. The word abortion.
where in the code, what are you talking about?
So let's see, this is for the lethal fetal anomaly.
Can you give me the site?
That would be, let's see. I don't, we should have page numbers. So,
You said-
okay, this is Indiana Code 1634. 1.5 informed consent brochure requirement.
Did you say 1.5?
Yeah, 1634 to 1.5 informed consent brochure requirements.
I have it.
And so it's very lengthy about what has to be done.
Where do you hear? Where do you see? Okay, because this from consent brochure.
To ask again, what is the question that's on the table?
Well, I'm not sure what we're looking for in here that Sally wanted me to see. But my question is, I mean, again, why are we using a medical term definition of
Because it's
abortion?
healthcare.
Well, but
It's healthcare of women with complicated pregnancies.
it is fundamentally though, I mean, look, there are statutes that deal with lots of different things, statutes that deal with healthcare, that deal with water quality, that deal with, building codes, but in every statute at the beginning, they give definitions of the terms so that everybody can be on the same page and that the legislators can be on the
The
same page.
legislators, the reporting on what the legislators were considering was a complete ban that would not include these exceptions.
Okay, but my question is, the question isn't actually about what the legislators are planning to do and about the exceptions. My
Well, that's what
question
it
is,
was for us. That's why we wrote this.
well, I know, but my concern is that in here, you're using terminology and saying things that, while in medicine, you might consider them, they might be called medical abortions medically, and that's fine. That's medical term,
And that's
medical jargon.
That's what medical people make decisions about.
Yes, but the people who are writing the statute aren't, and the people who you're communicating to in this document aren't by and large medical people.
Exactly.
They're legislators.
Right.
And they have their legislative term for what abortion
And we
means.
wanted to make sure they understood the medical term.
But that doesn't matter because
It does.
when, no,
No,
it
it really
doesn't.
does.
No, okay.
This is the point I was trying to make, is that I did not want to debate the definition of abortion during a Board of Health meeting. So and I feel like that's where we're devolving into that part of the conversation. I understand, Ellen, you're saying that legislators wrote this and they define it one way. In this statement issued here by the Department of Health, they used medical terminology because they wanted the legislators to understand from a medical point of view how they talk about it,
Wait,
how
I'm
they
sorry.
talk about
You're
maternal care.
saying that, okay, but
You know what? I'm not going to get into picking apart my words. I am not a healthcare professional. I'm trying to explain what the health department did and the choices that they made. I think we need to agree that your understanding it is you would have preferred that they would have used the exact language out of the Indiana code.
well, okay, I mean, I guess this is good, though. It's probably good for legislators to know that when they are considering these revisions, that what you are considering abortion might not be an abortion under the statute. And therefore, a lot of the things that you're talking about, like pregnancy, I mean, I'm assuming that a lot of the things that you're talking about really wouldn't be affected by any sort of restrictions because they're not abortions.
Oh, they're going to be. They are abortions and they are going to be affected by those restrictions.
But here's the thing.
Terrifyingly so.
When are you talking about like,
For life of the mother, for instance.
okay, but my question is, I mean, we're talking about this definition, induced abortion. A medical intervention provided to end the medical condition of pregnancy and includes the use of medications to induce contractions and a procedure. I look at this definition and I think to myself, well, wait a second. A medical intervention, this could include an abortion as it's defined in the state statute, meaning termination of human pregnancy with an intention other than to produce live birth. So the intention is to go in to end the life of the fetus and then remove that fetus from the body. Okay.
What do you want to achieve by this conversation?
What I
What
want to achieve
the
is
point?
that this is very confusing and it's telling women that there are things that are abortions that are not abortions under the statute.
Yeah, they're going to be abortions under the statute. And I think women should
No.
completely understand how this statute is going to affect their high-risk pregnancies.
I don't, okay, I feel like this is a difficult situation because, for me, because this is the legal question. I'm the only lawyer on the board, so I know I'm thinking about these things a lot differently.
Marcella.
Well, he's not technically a board member.
I know, but he gives us legal advice. He gives us legal advice.
Do you want to chime in?
Excuse me, hold on. I'm going to call for order and we are going to end this part of the discussion because we're not going to get to the bottom of this. We are not going to decide this abortion definition, and by the way, it's all going to change now in just a matter of days, right? That the legislators are meeting.
Mhm.
So perhaps we would have another discussion at that time after the new legislation is put into place.
Okay, I just want to state on, though, that my concern is that because these definitions are much broader, they're defining things that are abortions that are not abortions under the law. That means that women might read this, doctors might read this and think that certain procedures, like maybe removing a dead fetus from a mother's body after a natural miscarriage.
But that,
We're not talking about that.
Well, but you are, you're talking about a
okay,
miscarriage.
so we're going
And
in
that's-
circles.
Oh my God.
I'm gonna invite Dr. Marker to come have a seat. He's, and then I'm gonna ask that we put this discussion on.
Because otherwise
pause.
I'm going to say something.
Okay,
So
so-
I'll refrain.
Okay, I would like to just push pause on this part of the conversation. New legislation is coming out that is going to yield even more discussion. And I think then it would be appropriate to have more discussion then. Okay?
Can I ask other questions about the health officer's report?
Yes, John, of course.
Oh, and one quick comment, just,
Okay.
and no response needed here. On the birth equity and justice of St. Joe County Community Engagement Worker, I feel like our staff is taking direction from a body that does not run anything by us or is not subject to our approval. I just want to, I don't know the exact structure, but if you could consider that.
Actually, Sally leads it. So she's the one who's, Sally, you want to respond?
But I don't,
But I think
I
she's,
didn't understand the
I
question.
think she's doing things at their behest and
At whose
at
behest?
the birth equity and justice of St. Joe County.
That's just our, we named our work group something to say what we were doing in the community.
I just don't feel like that comes to the board here, whether it's supposed to or not, I don't know. It just seems odd to me.
It just as a work group working on, I mean, on recommendations to achieve equitable outcomes in birth.
It's one of many
There's something
work groups, John.
specifically that we're working on that.
Just, it bothers me that you're going to legislatures on some mission from that group and the board has no knowledge of that.
So that we have
That
been
just seems
talking
odd to
to the legislature for years about everything from trying to workplace accommodations. This year they passed Medicaid expansion for postpartum. So we have an ongoing conversation with them that allows us to do things like with the formula shortage. I was able to reach out to Congresswoman Worski's office.
And I'm not saying that they shouldn't do that. I'm just saying, should the board be a little more informed about what's happening? That's all I'm asking for. Second question.
John, I will do my best to ensure that that there is that there is more, I don't want to say more clear communication, but I will try to emphasize the communication that does come from the FEMA group and in all of their working groups. We have tried to enlighten and inform the board as well as the public through the board meetings. Sally has presented on a couple of different occasions now to this entire board. She actually has discussed these things to the board previously. I recognize that it's fairly complex information. And so what I will do, John, is try to emphasize what does come out from the board. And perhaps we can just look again at the schedule of when our unit directors speak to present to the board here, and we'll make sure that that we have some discussion about this at a minimum a yearly basis, but perhaps maybe even a couple times a year.
Although Sally did just present very
But she-
nicely a month ago.
I was caught off guard by that document. It's a beautiful document, but I didn't even realize they were doing that.
So,
John, you had a second question.
Second question, how's the budget going?
well, ask me at about 7:45. I'll be leaving here at about 6:30 to go downstairs to meet with the county council committee to present the budget. We'll see. I have no feel yet, but
Okay.
we remain hopeful.
All right, thank you.
quick question back with all of the different FEMA working groups. Could we have a list of everybody who's on all of these different subcommittees? Because, okay, thank you, because
That was offered in a previous meeting, the
There's not
last
an
meeting
updated one
and the
yet.
2 meetings ago, we had this part of the
So August 4th,
conversation.
this will help a lot. August 4th, there's a, I don't know if everyone got that yet, but there's a community action update where I do that quarterly. We weren't really doing it during the pandemic, but that's starting up again. And then there was the comprehensive report. Most of the people are the same. The one that you got when you joined the board, that has everyone's name on it.
okay,
And I'm in the process of bringing that all up to date. So our K3D team's up to about 35 members of people from all of the community hospitals and community agencies.
and then all of these other teams,
That would be,
okay, because there was the community action team, but then it looks like you're broken down into these subgroups.
we operate more like work groups.
Okay.
Versus like a big community action team, because we found 6 years ago as we started to do this, that it was hard to get work done, with bigger groups. So people that are interested in working on like safe sleep, we do that. Or right now we have a group working on maternal mental health.
Can you give a list of who's in all of the different work groups?
Yeah.
Okay, okay,
That's actually in that, there's little asterisks depending on what groups they belong to. So
okay,
that's in that original report that from
Okay.
really, we don't do that big comprehensive one every year. But I'm actually working on updating all of that. So
okay. And you said August 4th, what do you have? When is that?
yeah, that's at Center for Hospice Care and at 10:30. It's also
AM?
available by Zoom.
Okay.
And so that's kind of like an update on everything we're doing from.
Oh,
so, thanks.
that reminds me, there's going to be I can't remember quite what it is, but a community meeting tomorrow at the, regarding the health equity report. Is that going to be available on Zoom?
I don't think it's available on Zoom, but
No.
it's open. You're welcome to come.
I know, I've got another commitment unfortunately, but, okay.
It's been well advertised.
Any other
Yes, Rick.
questions for Dr. Bob for that? Sorry, Bob, I cut you off.
We welcome people to come to our discussion of the health equity report. That's going to be tomorrow evening, starting at 6 o'clock, and it's going to be at the Civil Rights Center, Heritage Center. So Cassie and Taylor and myself and Mary Washira will be presenting, and we hope that folks will attend that. We welcome them.
6 p.m. tomorrow.
Any other questions regarding the health officer's report?
Thank you.
Awesome. Thank you, Dr. Bob. Thank you, Sally. Moving on to new business, our first item is appointing Dr. Cruther to the Finance Committee with so
Room giggles.
that's where the opening is, and we would love to have you on the Finance Committee. And my understanding is we need to do a vote on that. Is that right? Marcel? Yes, exactly. So could we have a motion to,
So moved.
Second.
thank you. Any further discussion?
I may decline.
Hearing none.
Thank you. We're all small business. That seems like,
Yeah, no, I
Good
I-
enough.
we can do it. We have.
Thank
I would
you.
do that.
Just for the formality of it, though, all those in favor of having Dr. Cruther on the Finance Committee, please say aye.
Aye.
All those opposed, the ayes have it. Dr. Cruther, welcome to the Finance Committee. The next item up is appointment of Robert Hellenthal, Dr. Hellenthal, to the Agricultural Advisory Board. Dr. Bob, might you say one word or two about the Agricultural Board?
Yeah, the Agricultural Advisory Board was created by ordinance many, many years ago. It's been relatively defunct. In fact, really had not been meeting. And when this was brought to my attention, I spoke with the commissioners and with Marcel and talked about what we should be doing. And we thought that the best approach would be to reformulate the Agricultural Advisory Board, and the board itself then would make a decision as to whether they would repeal the ordinance or make a suggestion to the council to repeal the ordinance or to revise the ordinance. The Agricultural Advisory Board particularly deals with CAFOs. So we're just trying to get this reset up.
Okay, So having had the CV in your packet, you're familiar with,
Very impressive.
it is very impressive, it certainly is.
Yes.
Um,
And now I know that he is an expert on midges because I looked that up.
I've worked with Dr. Helen for over 20 years and he is awesome.
Yeah, sounds like it.
In person.
He has quite a reputation at Notre Dame.
Yeah,
Yeah.
he's on the Judy Creek Task Force. He's been on several of our committees.
He's been on everything. His CV is like half this packet.
Yeah.
Right.
It is.
Right.
Yeah, it was amazing.
Good level-headed guy. So sure, I would make a motion to we appoint him to
I
the.
would second that.
Thank you.
Yeah.
Any further discussion? Hearing none, we'll do a vote. All those in favor of asking or appointing Robert Hellenthal to the Agricultural Advisory Board, please say aye. All those opposed, the ayes have it. Welcome, Dr. Hellenthal. The second one is, or the next appointment is similar to Dr. Hellenthal's, that is Dave Jeffers, and we have his CV as well.
Real quick, just for the record, it's Ronald Hellenthal, just to get that right.
Thank you.
Ronald.
Ronald
Ron. Okay, yeah.
Hellenthal. He's got a long CV. There we go.
I've known David as well. He's not as awesome as Dr.
Won't tell him that.
You can tell him that. I'll tell him that.
They get in trouble.
He's a good guy and he's been helpful on a lot of groundwater issues.
Nice,
So,
nice, nice.
I would make the motion to approve or to ask him to serve at our behest on the Agricultural Advisory Board.
Second.
Awesome. Any further discussion? Hearing none. All those in favor of having Dave Jeffers on the Agricultural Advisory Board, please say aye. Any opposed? The ayes have it. Welcome to Dave Jeffers to the Advisory Board. And next, we're going to welcome Sandy Pontius, who is a tobacco education coordinator, and she is going to give us a talk about what's happening with tobacco control here in St. Joe County. Welcome.
Thank you. Thank goodness that you have this because I was unable to connect to Wi-Fi on my computer, so yay. I need to make this a slide.
Yeah.
I've got a clicker here. Oh. You want me to do it or you want to do it? Great, okay, so this is what I'm here to talk about. I'll do this. Like this.
Laura, and then it's a presentation. I don't know where the presentation is.
It's a PDF.
It's a PDF. Never mind. Go ahead.
You just have to scroll. So
So I just need to scroll.
Yeah.
Yeah, just scroll down.
Oh, I see, okay. All right. That's weird.
Or arrow.
Go the arrow to the bottom. The arrow on the bottom.
There you go.
Or just use your finger on the touchpad.
Yeah, it's a touch screen. Use the screen.
Oh,
You
okay.
touch the screen.
Do it.
I don't have one of those newfangled. So this is our mission statement for tobacco initiatives, improve the health and quality of life of citizens and create a culture within the community where the use of tobacco is no longer socially accepted behavior. Let me also say I apologize for my voice. I injured my vocal cords when I had pneumonia and it's not quite, it's been a month. It's not quite back. I have an appointment next week. So I'm just really here to kind of talk about what we're doing, what the Tobacco Initiatives is doing in St. Joe County. Starting off with, just a little bit of the tobacco landscape. I think the really important things to know is that every Indiana taxpayer household pays over $900 a year to support the healthcare of smokers. And it costs $590 million in Medicaid costs. Maybe I just do this.
Probably do it on the.
Okay, so our state agency likes to call this the tobacco control vaccine. Basically what that is just the policies that we use to make those changes. So smoke-free air policy is very important. Access to cessation, which I'm going to talk about. Tobacco price increases, which you guys can support when we go to the state. We haven't had a tobacco price increase in 15 years. And then of course, media campaigns, which are always effective. These are the 4 priority areas that my grant covers, and that is decreasing Indiana youth and young adult. Tobacco rates young adult was just added, so we're working with colleges as well as schools, public schools and private schools, K-12. Increasing the proportion of Hoosiers not exposed to secondhand smoke. That's about smoke-free air laws. South Bend has a really good, strong smoke-free workplace. No workplace can be smoked in. It's completely comprehensive. It's the strongest in the state, actually. We'd like to spread that across the county because a lot of areas are not covered by that. Oh, whoops. 3, decreasing Indiana adult smoking rates. That's talking about cessation. And this is really about our creating coalitions and working with other community members to get these things done. So just a little bit about youth use in St. Joe County. I mean, the cigarette smoking has really declined, which is really great. You can see how low they've gone down. High school rates, we've gotten down to around 5%. However, e-cigarette use has increased about 350% since 2012 when Juul came around. It's an epidemic. It's something that we're really dealing with. And I took a 3-year break, came back to tobacco and was like, what is all this about this e-cigarettes? I asked my children who were in high school at the time, this is really a thing? And they were like, Mom, you have no idea how bad it's worse than you think. So that's the first time I ever just so you can see, so here are some of the trends of e-cigarette use now. This is from our youth tobacco survey from 2018. We will be doing another one, so I'll have updated information for you next year. So how are we going to do this? How are we going to reduce these youth tobacco rates? Of course, promoting smoke-free environments and tobacco-free environments. We're reducing youth access and exposure to tobacco marketing. That is a point of sale. We just did a survey of all, not all, but a good portion of the tobacco retail outlets in St. Joe County and found some really interesting and disturbing things. They're very targeted to youth. You will find slushy dogs next to tobacco ads. You know, you'll see ads hanging on top of ice cream, you know, things that kids like near candy, especially near candy. You see a lot of these ads. Of course, we want to raise the prices. We are going to be reaching out with colleges. I'm working with schools to create policies that are less punitive to the students that are caught, because really they're targeted by these tobacco industry. They're young, their brains aren't fully developed. They're getting tricked by the tobacco industry. And so we don't want to send them home the first time they get caught and they just go home and vape. Right? So that's not even effective. So we're really trying to have more educational consequences rather than fines or suspension. And yes, we did get the legal age up to 21. So second priority is increasing protections from secondhand smoke everywhere. So not just in workplaces, but also in housing. Fortunately, we were really glad to see that HUD made a rule that all HUD-owned properties had to go smoke-free. So a lot of the subsidized housing and the housing authority properties are already smoke-free, which is great. But a lot of the market rate multi-unit housing complexes are not, though we have seen some go smoke-free, which I was surprised also when I came back and said, oh, Castle Point is now smoke-free. Great. So some of them have, but there's a lot that haven't. And it's really dangerous, especially in some of those non-HUD owned subsidized housing properties, that the smell, of course, which if you can smell it, it's the third hand smoke. It's particles from the tobacco smoke. It goes through windows, walls, vents, outlets. It's everywhere, and they're too small to see. Of course, the particles can't be seen, so it spreads throughout the whole building and puts everyone at risk. Priority 3, decreasing adult smoking rates. We really love, we're always looking to increase calls to the quit line. The quit line is a great resource. It's totally free. Everyone that calls gets a coach that'll help them make a quit plan. Right now, it's their 15th anniversary. Everyone is getting 4 weeks free nicotine replacement. And that's combo replacement, actually. They can get patches and lozenges if that's what they want to do. I do facilitate a program called Courage to Quit. Actually, my class starts tomorrow. It's a 6-session program where the first 3 sessions, we kind of make that plan, look at what our triggers are, what are the techniques we can use to get past those triggers. Everybody quits together after the 3rd session. And then, of course, it's just maintenance after that. Everyone who has made it all the way through my class has quit successfully. I want to make sure I say that. Not everybody makes it to the class. And that's because, it's addiction, right? Addiction is tough to get over. And so I always invite them back if they don't make it all the way through. It's an average of 7 attempts, for all smokers before success. And then, of course, we would like to help employers promote quitting in their workplaces as well. One thing we always care about is that the higher rates of tobacco use among marginalized populations, a lot of times it's because of targeting, especially LGBT populations who are highly targeted by the tobacco industry, went to bars, gave them free cigarettes, supported their causes. Same thing with menthol and African Americans, which is not on here, but still, they supported the NAACP, supported a lot of causes, hired African American, executives before anybody else did, and that was all to build, sponsored cool jazz festival, things like that, to build goodwill within the community, so they could get them addicted to a product that has a higher rate of killing them. And all of these folks, Medicaid enrollees, about almost half of the people in Medicaid in Indiana are smokers, about 40%. Yeah. So, for those with mental illness and substance use, those that are handicapped, a lot of very high instances of smoking. And so that's a lot of the people that we're working with. This is really, some of it, just increasing the knowledge. Now the attitudes and beliefs necessary for these smoking behaviors to change. And we do that by forming a coalition. Our coalition is called Smoke Free St. Joe. We have lots of different members, not just of the healthcare industry, businesses, anybody, we do have a lawyer that's part of it. He doesn't come all the time. We don't have a lot of law questions, but he is part of our coalition. And then the coalition members will support our campaign when we do ask the county council to expand that smoke-free air ordinance. We are looking to add representation from some of these places, and also we're always looking for business. If anybody is interested in these issues, please reach out. We'd love to have you. We meet once a month. We're still meeting virtually, 8:30 in the morning, 3rd Thursday, just an hour. We will have committee meetings that will work on specific things, but I know about it if you're interested. I don't want to take up too much time. And this is our last deliverable. I just bring it up real quick. It's actually a really great training. The Bringing Healthy Steps. We do it with the Head Start in Elkhart and St. Joe County. We partner because it's one big organization. So I partner with my counterparts at D in Elkhart. I also have trained the Beacon Community Outreach and the Goodwill Nurse Family Partnership staff. This is really designed for home visitors. So if anybody goes to people's homes and they notice, that they are, which is very easy to notice, that they are smokers, this gives you the tools that you can use to talk to them about cessation, recommending, referring them to the quit line maybe, recommending, giving them that education of why cessation is a better choice. And that is our program. Are there any questions?
What questions do we have for Sandy about this?
So I have a question. It's kind of tangentially related to the E6. And I guess I'm going to preface it by saying this. So I mean, I've never smoked. I don't think I've never touched a cigarette. But I have a family member who is older, started smoking in the 60s, chronic smoker. So for me, that like, I come from that framework and I think, well, something like an e-cigarette, would that be better? I mean, if you could switch from that, like regular tobacco products to e-cigs in that sort of scenario, my thought is that, would that be better?
So here's the problem.
And I guess that's the thing, because I'm also asking like, but then we're worried about it in youth. And so is it because there are problems with the e-cigs, or is it because there are problems with switching to cigarettes?
Yes,
Both?
yes. So
Okay.
the problem is it's not very effective for cessation because it's full of nicotine.
Okay.
And some of them, like the Juuls, have even more nicotine in them than the cigarettes do. So for example, my brother, who I love, who lives in Florida, quit smoking before he had to have his foot amputated by going to an e-cigarette. But he keeps telling me, God, I'm still craving cigarettes. You know, even this e-cigarette's just not enough. And I said, John, it's because you're still addicted to nicotine. It doesn't take care of the addiction. Now, there may be fewer chemicals, but it's really just another set of chemicals. And I'll do this real quick because I like to do this with young people, and it's a good illustration. I have 2 glasses of water. This is pure spring water. That's sewer water. Obviously, you're going to want to drink spring water. But if I just took a drop of sewer water and put it in there, would you want to drink it? No, but there's just a little bit of bad stuff. It's much safer than this bad stuff, right? And that's how vapes are. They're kind of the same thing. They're still full of chemicals. You're just trading one set of chemicals for another. They're not effective. They have not gone through the CDC or the FDA, process of being deemed a cessation device. They won't do it because they know that it's not effective. And so they just want to say they can help you quit smoking, although they cannot do that anymore. Actually, they can't say that. I don't have a lot of sympathy for them, especially companies like Juul, because what they did when they first came out was go to youth and market to them. They, swear to God, went to schools and said, you know, we have this type of presentation, how kids should not be using these products. Wait, come on in. Okay, these are for adults. You guys are not adults, so these are not for you. But just know that when you are an adult, they're perfectly safe to use. I want kids to want to be adults, right? So that's not effective either. And they've been doing that. The tobacco industry, they're the bad guys, not smokers, you know, not vapors. The industry are the bad guys. They know their product is deadly. They keep selling it anyway. They make a lot of money.
Yeah.
So I would rather them come to my class and let me get off of that addiction.
That's a good question.
Go ahead.
Is that okay?
Yeah,
No,
ask a quick question.
Excellent job. Can you talk about relapse? Like, so people go through smoking cessation, what percentage?
Yeah, it's that addiction is so strong. What nicotine does is it binds to your dopamine receptors. And so once it does that, the dopamine can't get to its receptors without the nicotine. So that's the addiction part. So when you're going through the withdrawal, you know, you're having stressful feelings, and that's why tobacco has like this reputation for, you know, chronic stress. It's really not. It's just the addiction that it's calming. But because it is such a strong addiction, if you don't quit kind of the right way, I hate to say it like that because there's not really a right or wrong way to quit, but you have to have, you know, techniques. It's, you know, just cold turkey, I'm not going to smoke anymore is not always effective. That's why, you know, in my Courage to Quit, we take that time to look at what are your triggers, which means, you know, I always smoke when I'm on the phone. Every time I get in my car, I'm going to light a cigarette, you know, et cetera. And then what are we going to do, you know, when we have those cravings? You have to know what you're going to do. Otherwise, relapse is very, very possible. But it's not, if it happens and people can quit again, you know, you have to go through it again, but you know, it does suck.
So what about like Nicorette gum, or are there patches? Patches,
So
like,
those
are
are-
those, what is your kind of take on that?
They are approved by the FDA as cessation devices. They have a much lower level of nicotine in them than a cigarette or a vape. I used patches when I quit more than 10 years ago. It's just enough to kind of take the edge off, right? But you know, gum, if you have strong cravings, gum or lozenges are good to use. I needed kind of an all-day situation. So we recommend that. The Quit Line recommends it. We recommend it. We don't recommend cold turkey because it's not successful. But I'm not going to tell somebody who chooses to do it that way that they can't. People tell me all the time they just quit cold turkey. And I'm, great, you could do that. We recommend using nicotine replacement. It's much more successful.
Awesome.
Thank you.
Thank you.
Thank you. Next on our agenda item, and the next two are Department of Health videos. There's one about public health emergency, and the other one is food services and pools.
No, are you ready?
Oh, yes. Do you want to say, do you want to? Or Bob, do you want to say something? You don't need to say something.
So you all may recall the video that we put together to describe our immunization effort, and that was well received by the board. The board encouraged us to continue to inform the public on what the Department of Health is doing. It was our view and our perspective that that there would be that a number of members of the public are not familiar with the various activities that the Department of Health is engaged in. And so we have created a couple of videos here to illustrate to the public what we do in a nutshell.
Sorry, they. Just stop the
Probably have
share.
both
Yeah.
share. Yeah. Cool.
Sorry.
Can you get rid of can you blow it all the way up for us, please?
Yes.
Tech support.
Awesome.
Start it over if you would.
Oops, sorry.
I haven't had any income since I lost my job. I've been living on the street for almost 12 years, and they said they did free laundry. And I'm like, this is a blessing from God Himself.
I'm loading in for a program we do called Wash Wednesday. It's every other Wednesday where we help people who are unhoused, living in shelters, or have any sort of unstable housing situation. They're able to do their laundry for free every other Wednesday at this Burton's Laundry here. Hey, how you doing? I'm doing okay. Yep, so the last wash is at 1 o'clock, so if you can get here before 1 o'clock, we can get you going. We do have donuts and bananas. I would say the homelessness situation in our community is not unique. We do have a population of about, give or take, 500 people who are continuously on the streets. Being the public health coordinator means that I take the lead on all things that impact the health outcomes of the homeless, as well as other duties at the Department of Health, kind of as they come down the line. And so we teamed up with a local laundromat, Burton's Laundry, with their owner, Mr. Newfer. He was incredibly gracious in allowing us to come into their space. People who are unhoused are able to come and get their laundry done for free. Absolutely, absolutely. Go get some washers, get some donuts, get going, guys. If the blankets don't fit in there, we'll put the blankets in a bigger one.
Okay, cool.
Yep.
Thank you, buddy.
Yep, no problem. And we'll get you some soap and everything once you're ready for that, okay?
Okay, thank you.
A lot of our guests who come in might have to choose between getting breakfast or lunch at a soup kitchen or food pantry, and I want to make that an easy choice for them. I want to make sure they have something healthy and something tasty to start the day off.
The first thing that I thought of when I ate a donut was like, it's like me being able to go to Martin's myself and experiencing that rather than going. And don't get me wrong, it's not, I don't mind going to a soup kitchen or stuff like that. It's like being in a real life again, a real world where you're part of something again, rather than being by yourself or all alone.
While people are doing their laundry, it is actually a good time to connect with people, get to know them personally. Sometimes while we're doing that, they'll identify needs that they have. So last Wash Wednesday, there was a gentleman who realized he didn't have any pants except the ones he was wearing. He could not find anything that fit him at any of the local clothing pantries. So I was able to make a few calls and find a local service provider who did actually have pants in his size, and we were able to hook him up with those clothes so that he was able to meet that need. I put down everyone's first name, I put down the program that they're with, if they are with the program. If not, if they're living out of their car or out on the street, I'll just put street or car. And then at the end, I put the weight so that we can approximate how many loads of laundry we've done at the end of the day and kind of have totals and everything, have stats. This program started in November of 2020, and so far we've washed a total of 49,040 pounds of clothing, which comes out to about 4,904 loads in a regular consumer washer and dryer. And we average about 144 loads of laundry per session.
It keeps us clean. It helps a person feel like they're a human being again, and I think that's the biggest part of it. And then with Harry's personality behind that, when you talk to people like that, it just blesses you.
This can be an awesome time to get into it and address people's social needs. It can also be a great time to just build community, build companionship, and have someone talk to someone who's not stigmatizing them, who will listen to them, who will, people just want to talk about what they did last Tuesday sometimes and not talk about these incredible challenges they're fighting on a daily basis.
I feel wonderful, and it's like, okay, so I have another start, and I have a great day, Clean clothes are the start of a great day.
There is a lot of emotional weight that comes with working with the unhoused, that comes with seeing such depths of suffering on a regular basis. And honestly, I'm not immune to it. I do carry a lot of that home with me, but at the same time, it only pushes me to go harder and do more. I consider it an honor to have a position where I know I'm making a difference in our community instead of just maybe thinking that I am.
And then the other one is on...
Let this soft mineral melt in your mouth to rebuild your gums and teeth and never need a dentist again. People are...
Okay, and then this one highlights our foods and...
Do you have to stop and share,
I shouldn't have.
Okay, just checking.
But that bar is gonna have to go up.
Yeah, I'll move it up.
Know that.
Sorry.
Never a dull moment, and no inspection is like the last one.
For the most part, we get a pretty good reception. Everybody's usually, I don't want to say happy to see us, because we do introduce an element of stress just by being there, whether we're having a good inspection or not.
Are these moments when they come in stressful? You always second guess, because it's not just me running the kitchen. I have a lot of hands. But if you have the right things in place, it ends up being a really good relationship.
It's kind of funny because people wouldn't think that food in pools, but we are responsible for aquatics.
I'm just getting everything set up. So I have some towels for basically to wipe my hands off with.
There are rules, there are guidelines for inspecting pools, just like we have for inspecting food establishments.
Every pool is required to have this posted. This is one of the warning signs. It has to be in a certain size font so that it kind of brings attention to anybody visiting the pool.
This would be my first question generator. So they're serving soups. I would ask them questions about their soup, how it's being cooled, how it's being, if it's kept over for the next day.
Every day, at least 2 times a day, they need to check the chlorine levels and the pH reading in the pool.
So like the oranges, the grapefruits, the melons, those are all going to be peeled or used for zest. So I want to make sure that there's no major dirt or debris, no damage or signs of pest activity.
Our objective is always to provide education. What you don't know can kill somebody, you know.
If you look at the pool and it's cloudy at all, or there's a real strong smell, everybody associates a real strong smell of chlorine, that, oh, that's good, they're sanitizing. Actually, that's bad. There's like zero sanitizing in the water going on.
One of the things Carolyn wants to really pushes is we're not a gotcha team. We're going in and we want to make sure that people have a good understanding of not just what to do right, but why, that it's important.
As any other public servant, they want to keep this town vibrant, alive, full of healthy restaurants and safe places for us to enjoy. It's their job. And to be honest, with a lot of them, it's their passion too. And it's interesting to see, because a lot of people don't make that connection, that you can be passionate about health and safety, but they are.
To know at the end of the day that you made it so that people stayed safe, that they did not get into a pool that could possibly make them very sick, or eat at a restaurant that the same thing could have gotten very sick, or you don't always know that you impacted somebody, but hopefully you did.
The last interaction that I would ever want to have with a guest is them getting sick. And they are a tool to help me continue to give great service and great food. I can't imagine ever disliking that. It seems to me a bit insane. Oh, I'm really upset that the people who are trying to keep my customers safe is coming in here to make sure my customers are safe. Come on, you're upset by that?
Our job, our main objective is to prevent, promote, and protect. And we do that through observation, dialogue, and education. And that's what we're there for.
Awesome.
Has a pool inspector ever fallen in? Has one of your pool inspectors ever fallen in?
That's fabulous. Who's up next? Do you have anything in production right now?
Yes, we are working on with our HEAD team, and it'll be around some of our equity work, some of the lead work. So
great.
Awesome.
Nice.
Yeah.
Those are very
terrific.
nice.
Thanks for doing this.
I think my favorite quote of the day, Carolyn, is what you don't know can kill you. That could be like our next quote underneath, prevent, promote, protect.
And the videos have been shared. The Wash Wednesday video has been viewed over 6,000 times, has been shared hundreds. Our foods video saw 2,500 views in the first 24 hours.
Wow.
So it's exciting.
It's very exciting.
Nice.
That's awesome. Yeah, thank you. Awesome. Okay, moving on to our next agenda item. Dr. Marker, before you came in, we added an agenda item. And so we're going to talk about how press releases are crafted and then vetted by the board. So Ellen, do you want to lead us into that conversation?
Well, I'll give what I wrote to kind of set the stage. This is what I have. As the numerous emails we've received indicate, and at this tally, I think we have about 50, 60, about 40 plus opposing the press release, about 10 to 12 maybe supporting it. There's plenty of debate. I mean, but they indicate that there's plenty of debate in this community regarding whether abortion promotes or harms maternal, infant, and fetal health, and whether the health department should have used public funds to issue a policy statement on the topic. Yet the board was never given the opportunity to review, discuss, and vote on the press release before it was released. And its release without board input gives the impression that the entire board agrees with the document, although this is not actually the case. That's why I'd like to discuss how press releases are sent and the circumstances under which they are vetted by the board. So how did this, and this is probably a good example because it's over a controversial topic. How did this, who knew about the press release ahead of time? Who decided to send it out, authorized sending it out, and why wasn't it brought before the entire board?
Yeah, so this press release was authorized by me and released by me under my authority as the health officer of St. Joseph County. It was developed as we have discussed to a large degree by a pretty large group of individuals under the direction of our FEMA coordinator, Sally Dixon. And this, yeah, enough said.
So did any board members know about this before it was sent out?
Yeah, I did. Before I sent it out, I sent it on to Heidi and Jason.
And why only Heidi and Jason?
I knew about it too, because I'm.
Did you know about it as well?
And all
Because
the
I
entire
typically,
FEMA board.
because I typically, if I have a press release that I think might at all be controversial, which this might have been, I send it on to them to make them aware of it.
So they're the ones who actually authorized it.
No.
No.
Let me
That's the health officer.
repeat what I just said. Get this, make sure you get this. This was released under my authority as a health officer, like I do for media releases almost every single day.
So
this is typical of the way that this health department and virtually every health department in the United States works.
Bob, maybe you could share with us how many press releases are put out from the department in any given month?
Again,
Dozens.
dozens.
Okay.
We do one every
Single day.
every business day on COVID,
Right.
since March of 2020.
As I mentioned previously, we'll have 2 or 3 encounters with the news media in a typical day. And depending on what it is, it could be everything from the heat to West Nile virus, to they get a call on Wash Wednesdays, to Black infant mortality, to you name it, monkeypox. How many times did I speak to the press about monkeypox, and how many inquiries have I had about monkeypox just within the last couple of days? These are coming over and over and over again. If I could, please, Robin would like to say something.
Sure. Just a clarification as well. So our daily press releases that go out and other press releases as it relates to the Department of Health activities, the thing you're questioning is a statement given in response to an action. So it went out in a press release format, but it's a statement. It's not technically a press release, if that makes sense.
what is the action in question? Are we talking about Dobbs, the Dobbs ruling?
What
Is
do
that the,
what do
what
you
is the, you said it's a statement in response to an action. I'm just wondering, what is the action that is
The
being
decision
responded to?
of the Supreme Court.
Yeah, the Dobbs ruling.
Yeah,
Okay,
case.
but you
So-
don't,
We released a statement about maternal mortality. Right?
the statement, or wait, what is,
Is that what you're asking about?
oh, well, this statement isn't about maternal mortality.
Which statement are you?
Or I'm talking about the June 30 press release. You said that.
Which one is this? Which one? Which one are you talking about? Because I released a statement about maternal mortality and child.
She's talking
Oh, I mean, the whole, you mean are you considering these all to be separate documents? the June 30 press release, you had the 2-page statement regarding Dobbs. And then there's like 4 pages of supporting documents. And they're,
About maternal and child health.
well, it says it's the title, Maintaining Exceptions to Indiana's Abortion Law, Life of the Mother, Rape and Incest, and Fatal Fetal Abnormality. That's
I'm sorry,
one.
say it again, life of the mother and what?
Mhm. And then you have one,
fatal
policy
fetal
recommendations for Indiana, health and well-being of women, infants, children, and families.
Yeah,
Is
thank
that
you.
what you're talking about?
That's what I'm talking about. Is that what you're talking about?
I mean, I
Is
just,
that what you're talking about? I'm just asking you a question, Alan. Are we talking about the same document?
yes, but I was responding
I think
to,
if there's confusion around, so typical press release and a statement, so that is not, typical press releases don't have dramatic statements like that. They're used to inform and educate, which is where this stands.
okay, well, this is saying that it's because this is, and is this intended to educate the public, or were you intending to present this to the public because this was something that you were actually, your intent was to present it to the legislature?
I think it's important to inform the public, and we frequently interact with the legislature on many, many different issues. Smoking, as you just heard, would be one. Septic systems would be another. Sally has spoken already about a number of initiatives that were passed by the legislature, in large part because of Sally's and her colleagues' initiatives to protect the lives of mothers and children. And if we're talking about all of our press releases, it is to protect the health of the community and to keep the community safe.
So I guess the difference here is that whereas other press releases that are typically sent out, like the daily COVID metrics and the press releases about excessive heat warnings and things like that, they're not controversial. And I don't think anybody, but this going out, I think it would be, I think it would be foolhardy to think that this wouldn't have been controversial, and that it would have been, there would have been a lot of disagreement in the community, which is.
Well, actually, if we look at the data, let's look at the data. And this has been reported over and over and over again. Greater than 90% of the people across the United States believe that the woman whose life is at risk because of pregnancy complication should have the right to make the decision whether she dies or has that pregnancy terminated. Greater than 90, probably greater than 95% feel that way. Again, looking across the United States, including within the state of Indiana, if we look at how many individuals feel that a woman who has been raped or a girl who has been raped, that the decision for what to do after that rape should be left with the girl or the woman, her loved ones, and her faith community, greater than 80% believe that indeed it should be left, the decision shouldn't be made by a legislator down in Indianapolis or by you, but in fact, it should be made by the woman who was raped or the girl who was raped, and with her loved one's input and faith community, if she so desires. The same holds for incest, and the same holds for if a woman who is pregnant and it has been determined that that fetus has a lethal abnormality or a lethal anomaly, that is, that fetus is going to die. Anencephaly would be one example. That the vast majority of individuals in this state, in this county, in this country, believe that the woman, and with input again from her loved ones, should make that decision. It shouldn't be a decision that tells the legislature what to do. I recognize that you have some sons. He has has one daughter, very similar to the 10-year-old who was raped and impregnated in Ohio. You may think that when your son is of age and he happens to rape his daughter, you and your legislator friends have the authority to tell Mr. Levin and his daughter and his wife what to do with that situation. And the vast majority of people disagree with you. They say, no, you don't have the right to tell this raped child and impregnated child what to do. That is a decision.
Dr. Einherz.
That is a
Doctor-
decision. I am not finished. That is a decision that is to be made by Mr. Levin and his daughter and his wife, full stop.
Dr. Einherz, talking about my 6-year-old son raping a
You
9-year-old.
want to, yes, I will talk about that because you want to not, we want to think that this does not happen to people in this room. You want to make this anonymous. I will absolutely say this because we have seen individuals, men who come from families just like you, who have raped women. And we need to make it real. And this makes it real.
Dr. Einherz, I am a board member. You do not criticize my minor children.
I didn't criticize your minor children. It was hypothetical.
Dr. Bob,
Happened.
We do not.
hold on, I'm
talk
going to
about
call
each
order
other's
for this meeting. The motion that you had made to adopt was to discuss the process. We're not talking about what is contained inside of a press release. You asked, what is the process? I want to get back to what the motion was, what you wanted added to. So we need to talk about the process, which has been explained about how it sounds like dozens of press releases are done daily. Your point that this could have been more controversial. Certainly, I think that goes without question, as evidenced by the heated discussion that we're having right now, certainly. I would like to hear discussion about process. Other board members, please, let other board members weigh in on process about a press release and vetting the press release. Yeah, Dr. Carter, if you have a comment or discussion.
I think that's the most important part. I mean, I know we're talking about abortion, but like to take abortion off the table and just talk about like what the next controversial issue might be. Like if we can decide, are there things that we as a board want to be able to chime in on, especially if we're going to get like emails from the community that say, oh my God, I can't believe you allowed this, or we're really happy about this. And we don't really, as a board, have a unified response to that. So that was kind of my open item that I wanted to hear what other board members thought. Like, what's the best way? Like, clearly, it's not to review tons of press releases every day. So we can take that one off the table. But if there are things that we're like, okay, this is a hot button issue, do we need to kind of come together and say, here are the things that if you're going to talk about this, we would like to be involved with it. Give us a couple of days. And if there's no response, release it as if you're speaking for all of us. But if not, then if you want to be like in the Supreme Court case, as I mentioned, like all the judges didn't agree. And like sometimes we're not all going to agree. And that's okay. But the people who don't agree can say, hey, I really didn't agree with that. I support the Department of Health. I support everything you're doing. This particular position wasn't one that I agreed with. So that's kind of where I thought we were going to sort of head with, like, grown-ups are at the table. Like, what does disagreement look like in this context? And what does agreement look like? And it's not going to be on every little thing. And I think we can all agree that we want to do what's supportive in terms of not delaying process, so that's.
I appreciate that comment. And what I want to pick up on is the differentiation between sort of the press releases that are a matter of routine versus those that are not. And so how do we set those metrics for the board so we can say the ones that are a matter of routine, those are not things that we necessarily as a board need to have come run by us, right? But then how do we set up the metrics or the definition of the ones that we deem that we would like to be able to see perhaps 72 hours before they go out, right? So you have an opportunity to comment, offer feedback to the health officer, and then we move on.
Right.
So let's have that part of the conversation in terms of like, how do we differentiate between those that are the matter of routine and those that will be not a matter of routine?
I think perhaps making a list that, if we could have a list of what things are typically routine press releases. So I'm just off the top of my head, I think of the daily COVID metrics. I don't know, do we have seasonal flu metrics that get sent out? Are there health metrics? Heat advisories.
Maybe it would be easier to have a list of things that you deem controversial. What do you deem controversial, Ellen, other than abortion?
Well, I think it would be better to have things that we deem not controversial, because we don't know what
That's
is
like
going.
everything.
But that's the thing, we don't know what is going to come up in the future that might be that somebody might think is controversial, but somebody else might not. So if we have a list of just things that are standard that we all agree on, you can send out the COVID metric every day without us having to sign off on it. You can send out those extreme heat releases, heat advisories without us having to sign off on it, extreme cold advisories. If we have that, then I think it would be, those are things that probably also have to go out right away anyway. So it would be easy enough to notify everybody of everything else and get that sort of sign off that Teresa is talking about.
Get all the press releases. I mean, we get press releases in our inbox all the time.
Well, we do, but we don't approve them ahead of time. That's just, as far as I know, that's just the media release, correct?
So
Dr. McGlury wants to say something.
know what those.
Or official job description or.
So
what
our
are-
official job description with regard to the press releases. So the Board of Health's responsibility is to set policy, right? And essentially to hire a health officer. Those are the essential functions, right? The health officer is responsible for the day-to-day management. We don't get involved in day-to-day management, and that is really well articulated in the Indiana code. So that is why it is well within the purview of a health officer to be able to do press releases without the authority or, approval of the Board of Health. Now, this may be a unique situation as evidenced by the folks that are in the room and so forth. So we are trying to have a discussion about how do we determine what things are matter of routine and what other ones we might decide that we would appreciate perhaps a window of time that we'd be able to get those ahead of time.
And I want to say, Heidi, you make a great point, because you mentioned that the requirement that the board is in charge of policy. And this is a good example. I mean, it says in the release itself, policy recommendations for Indiana. It's self-described as a policy document. So it seems like this would be an example of something in which the entire board should have weighed in. Whereas something like COVID metrics
Okay,
isn't
so
a policy.
they'll allow me to clarify then. We set big P policy, and it is absolutely explicitly in the Indiana code that it is a health officer who sets the day-to-day policy that happens here at the health department.
Well, how do you define big P policy versus day-to-day policy?
So like, for instance, the budget, right? We make determinations, and the budget is what sets, that is our calling card, right? That tells everybody what is important in terms of how we are funding the health department, what our priorities are.
Okay.
But that's where it is. Dr. Bob does not need to come to us on a day-to-day basis and ask us, can I, move somebody from the 8th floor to the 9th floor? Can I modify this policy about people punching a card or not punching a card? That is his job, nor do we want to. My goodness, we're a volunteer board. I want to get back to the agenda item that was approved to discuss, and that is, do we want to have certain press releases come before the board? And we have not defined what those press releases. May I also say, we could also table this discussion and allow a time to gather some more information. For instance, perhaps maybe an inventory of the types of press releases that have gone out in the last 30 days. And then we can determine and discuss that among ourselves. Would that be appropriate? Would people be comfortable with that?
I think that would be a good idea.
That would be
Yes.
smart.
Then that's what we'll do. Marcel, did you capture? Fabulous. Dr. Marker.
As we do that, we've talked about maybe some listing of controversial, less controversial, however that may be, but I think also that's an opportunity for us to think about what are policy decisions, what are educational releases, where's the gray zone between those sorts of things, what is a policy recommendation versus what is an actual policy that's being discussed in some of these. It gives us a chance to parse down some of the things that are sent out from here and decide which of those categories are important for additional review and which are not.
Make note of it, and I'll follow up with Jenny after the meeting. Not tonight, though. We'll do that later. Okay.
Just Heidi, real quick,
Yes.
rolling around in my mind is taking abortion off the table. Is what if it was gun control or restricting guns in some way, because they obviously kill people. That is there a way that, obviously that's not in any of our policies anywhere, gun control specifically, but so something like that, we'd sure like to talk about it with you before goes out. So just as an example to think about over there.
Right, that would be a future, perhaps hot button topic that, okay, cool.
But I think also along those lines, things will change over time. This would need to be a fairly dynamic document that changed over time. There may not feel like there's anything controversial about the COVID metrics today, but 18 months ago, that was.
There
very
was a lot of
controversial.
controversy about the
That's a good
metrics,
point.
right.
And so what we think is controversial today may change over time. And as a board, then it will be our obligation to stay up with those changes over time so that we can adjust the list as appropriate.
Thanks for that. I may say also, because we have a lot of new faces in the room, if you are here for public comment, you do need to sign up on the clipboard if you're here for public comment. Agenda item number 8 is board notifications. We've had 2 hirings in the month of June, Norma Van Est and Emily Badola, and we welcome them to the health department. And then we're saying goodbye to Giovanni Alvarez, who was an environmental health specialist. And there were no retirements and terminations. And so we're going to move on to public comment. And I'm going to read the following statement. At regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate any person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. So I'm the president, and I will be keeping time. I have a timer here, and then I set it for the 3 minutes. And if you stop early, that's totally fine. Then we will move on to the next person. And Jenny, will you call out the first person, please?
Cynthia Heckerman Davis.
Cynthia? Yes, go ahead.
Cynthia Heckman Davis, Walkerton, Indiana. I want to commend the Department of Health for their statement to the Indiana General Assembly. It was well written, it was evidence-based, and I hope the future releases and statements are similarly following evidence-based science. I feel that the board does not get to judge or vet science. That really is not the board's responsibility, it's the Department of Health's responsibility. Our Indiana General Assembly is considering a bill that will allow exceptions for incest, rape, and the life of the mother. And yet experts are saying that even with that, there will be, they estimate, a 21% increase in maternal mortality in Indiana, and in our Black population, a 33% increase. So anti-choice folks say abortion kills, and it's also clear that abortion restrictions kill. I think it's important for us to all start to move together. I like what Dr. Cooper said, that we're not always going to agree on this, but there is so much opportunity and so much work that those on both sides of this issue can do to move the health of our county forward. Thank you.
Thank you. Jenny?
April? I'm April Ladinsky, live in South Bend, and I'll be brief. I support what the health department has done in this particular statement, which really is, as they say, their role is to inform and educate our community on how policy decisions impact public health. And I think this document does that with great clarity. I stand with the majority of people in our country, in our state, in Indiana, who support access to abortion care. And we'll say that all the statistics show that people from all walks of life, all faith communities, seek abortion for personal reasons that are best decided for themselves, by their families, in consultation with medical experts. Legislators do not belong in that room. I look forward to more public health statements from the board and really appreciate all the work and time that you all put in. Thank you.
Thank you.
Ken?
My name is Ken Smith. I live in South Bend. This is my first visit to one of your meetings, and it's been incredibly educational, and I'm grateful to be here. To see you all bringing expertise and building expertise, asking questions where you learn new things in the middle of the meeting. teaching medical insights and the presentation about cigarettes or the two films I learned in the meeting. And it's a beautiful thing, and I'm grateful for it. I would have guessed that what I would learn was science and medicine and things like epidemiology and water quality and so forth, but it was much broader than that. It had to do with people who are vulnerable, whose hearts were protected by policies and programs. It had to do with social things. It had to do with touching the emotional core of people in our community. This has been a beautiful experience, and I would like to say to the board that if you would like to in the future continue to hire excellent health officers, you cannot say on the job ad, you will not be allowed to be controversial. We need people who can't. We need people who will speak truth to power, to each other, to the community, to legislators, etc. We can't have a good Board of Health without the risk of controversy based on teaching knowledge in all those areas, not just science and medicine, but the social, the heart. It touches on many people's faith. I grew up in a household, I grew up in a household where one parent was a Southern Baptist and one was a Catholic, so I've known for a long, long time that there's not one Christianity and there's not agreement. And I know I have dear friends of other major religions. Indiana is a diversity of faiths, and we need to have a community where people are teaching science and medicine, where people are speaking from faith, where people are speaking from experience, where people are helping us understand law, as unreadable as it often is, and how it keeps us at arm's length so much of the time. We need people teaching us all those things. This is apparently, I've just discovered, one of the places where that work goes on. And I thank you. And please continue to teach all of us about women's health.
Thank you. And you were right on the money. And welcome to your first meeting. Pam?
My name is Pam Clays. I live in South Bend, Indiana. I too want to give you all thanks because you have in this document given so much educational information. There is a lot of work that went into this and a lot of study. And it took a lot of time and a lot of effort. And you used that study to help us understand how actual lives could be affected by policy. And I think it was excellent. I fully support your statement. I believe it could be even stronger, but that would be more controversial, so I won't say that. But I thank you for everything that you do, the time that you take, the information that you provide. I wish more people could have seen this. Thank you.
Thank you. Jenny.
Erin or Owen Clark. Hello, everyone. My name is Erin Clark. I live in Granger. I'm an emergency medicine doctor who lives and works in St. Joe County. Again, I echo what everyone else says. The work that you guys do here is wonderful, and we all benefit from it. As a physician, I've personally seen the devastating consequences of unintended pregnancy on mothers and children. The recent statement by the St. Joe County Health Department regarding the DOPT decision was well stated and based in science. In my opinion, if they had not released such a statement, they would have been remiss in their duties to protect the health of the public.
Yeah.
Releasing the statement is well within their scope. Research clearly shows that states with restrictive abortion policies have worse maternal and child health outcomes. This is because dogmatic adherence to keeping a woman pregnant, no matter what, no matter how dangerous it is to her physical or mental health, no matter how lethal the fetal anomaly, will inevitably lead to increased morbidity and mortality, the very things the health department should try to prevent. Anyone who would claim otherwise is either ignorant of, or even worse, deliberately ignoring the data. Pregnancy-related decisions are not black and white, despite how some supporters of the recent SCOTUS decision would try to portray them. The St. Joe County Health Department is not advocating for abortion. They're simply recognizing that nuanced situations in pregnancy happen all the time, and a widespread ban on terminations will lead to poor health outcomes. The health department is trying to improve the health and therefore the lives of all St. Joe County residents. As a physician and county resident, I strongly support their statement.
Thank you.
I'm Alan Clark. I was the other one up there.
Oh, I see, he's next. Go ahead,
I
please.
thought it was an attendance sheet, so I wasn't. I'm an OB/GYN community. I've had these conversations with my patients on a daily basis. I do support the statement, but I would also encourage in that table discussion, consider whether or not medical personnel need to be very involved in crafting a medical statement. So I just would encourage the board to consider doctors being involved in that. And I know there's some members who are doctors. I don't know who you all are. I agree with it. I think medically speaking, it was a very accurate document.
Thank you. Jenny.
Melanie. My name is Melanie Lyon. I am from Mishawaka, and I'm here to express my concerns over the press release that was sent out by the St. Joe County Health Department on June 30th. And I've talked to many members of the community who share my concerns. My statement is limited to the St. Joseph County Health Department's press release on the occasion of the Supreme Court decision in Dobbs versus Jackson. The statement is replete with errors and fundamental misunderstandings of both health and legal questions at play in the decision, and I urge you to rescind it. As we've discussed, Title VI of the Indiana Code, I think definitions are important. Defines abortion the following way: abortion means the termination of a human pregnancy with an intention other than to produce a live birth or to remove a dead fetus. 3 of the 4 definitions of abortion provided in the health department document, spontaneous abortion, missed abortion, and threatened abortion, are not legally considered abortions under the Indiana Code, and care of such conditions is in no way analogous to elective abortion, which is what's at issue in Dobbs. The statement urges our state officials to learn and understand, or quote, our state officials to learn and understand that abortion is necessary in the management of pregnancy complications. This is simply not the case. The examples of pregnancy complications given in the document, including ectopic pregnancy, management of miscarriage and early induction, are manifestly not treated by abortion according to Indiana law, nor is there any indication that this definition is up for review by the Indiana General Assembly. As someone who has close friends who have been through sexual assault, I was also concerned about that portion of the document. The document listed 5 side effects of sexual assault without connecting them, without underlining that abortion is a treatment for those causes. And I'm disappointed that abortion is pushed as a solution for the violence of sexual assault instead of moving to a more holistic standard of care. To confuse and conflate these definitions is misleading at best and disingenuous politicking at worst. It invites confusion about matters of women's health and is extremely misleading to the residents of St. Joseph County regarding the care to which they are entitled in the state of Indiana. And I urge you to issue a prompt correction of this overstep.
Thank you. Jenny.
Lisa.
Lisa.
Ikonovich?
Yes. Okay, there you go. I have 3 minutes. Go ahead.
I'm from Mishawaka. The health department in St. Joe County does not need to insert itself into abortion politics. Abortion is not normal. Abortion is not healthcare. Abortion is murder of an innocent, precious life that deserves a chance at life, like you all know. Whatever happened to do no harm in healthcare. Also, the COVID vaccines are not safe and effective. And if this health department is also promoting that, you are committing fraud and false advertising. The truth has already come out from a court-ordered Pfizer document to be released. Did you see it? I have a copy of it right here. If you haven't seen it, it's 38 pages of adverse reactions and includes death from the COVID vaccine. It takes 60 minutes to read their reactions out loud. So if you are still promoting this, you better think again. There is real possibility you could be tried and prosecuted in the future for your false statements. Where is the true informed consent? Shouldn't these 38 pages of reactions be given to those uninformed people or children you are telling to get the COVID vaccine, the COVID so-called vaccine, which it is not, because the definition of the vaccine had to be changed for this one.
Don't you think the public deserves to have a real informed consent? The definition of vaccine had to be changed for this mRNA gene altering injection. It is not safe and effective and should have been stopped a long time ago, and actually has caused more deaths than any other real vaccine combined in the last 30 years, and caused COVID outbreaks from the variants from antibody-dependent enhancement. Look it up. I got stopped on that one the last time I said that. This is all, if you were a true, this is all coming out and being exposed. Truth will prevail. If you were a true health department with a conscience, you wouldn't be promoting abortion or this COVID-19 injection. Your outreach you are trying to extend is not good for anyone's health. By the way, most SIDS, sudden infant death syndrome, deaths occur within 7 days after vaccination. Now we suddenly have SAD, sudden adult death syndrome, happening everywhere. I wonder what that could be from.
You have 10 seconds.
Dear God, help us all.
Jenny, who's next on the list? Daryl? Daryl,
Yes,
you have 3 minutes.
thank you. Daryl Heller, I live in South Bend. I also direct the IU South Bend Civil Rights Heritage Center. And so I just want to reiterate and support everything that those who spoke in favor and in support of Dr. Bob and the staff and the Department of Health for issuing this order. And the thing I want to add, or my contribution, is that I really see women's right to choose and to determine their own body autonomy as a civil rights and social justice issue. And that needs to remain, that needs to be, if we're going to continue to call ourselves or think of ourselves as a progressive, enlightened society, then we need to be forcefully and aggressively supporting people's right to choose what happens with themselves, not have it legislated. In the department, because my particular concern is all women, but particularly women of color, and the impact of this policy and this new ruling, the effect it will have on the health of women of color, particularly poor women. And I, just along with that, really agree with and thankful for the statement that came out earlier in the past year, racism as a public health crisis. I think this complements that, and I think that the statement and the work that the Department of Health is doing is advancing the interests of all of St. Joseph County, and I stand wholeheartedly behind their work.
Thank you. Jenny.
Katrina? Hi, I just wanted to iterate what this wall over there had said about how expertly written the statement was, how much it did adhere to science. What incredible work this board has done. I cannot thank you enough as a long-term resident of this county, raising 2 children. Well, my daughter is here, I have a son, and I appreciate your expertise. I appreciate the board handing expertise to the experts. I will say that there's a funny old story. It's a true story that at one point the Indiana legislature tried to legislate that pi, the number pi, was to be now declared to be 3. And the mathematician happened to be on the floor that day and asked to address the legislature and explained why pi is not 3. And the motion was tabled. It's still tabled. Legislatures sometimes do not know about the science. I'm a mathematician. They sometimes don't know the science. So I appreciate the actual medical terminology, the scientifically correct terminology. Legislatures do need to be educated about things that they are not experts in. Often, I need to be educated. And I felt like this Board of Health has educated me multiple times throughout the pandemic. I appreciate your work on this statement. I greatly appreciate your work. Until you have been the mother of 2 children, having gone through 2 late maternal health pregnancies, and find out that you were pregnant again at the age of almost 43 with 2 beautiful children and your life at risk. It is personal, ma'am. It's very personal, and you have no business telling me what to do. or
No,
anybody
that
else
becomes,
accountable.
we don't address the individual
Sorry.
board members in that
Thank
way. Thank you.
Anybody in here? Oh, yeah, no. Anybody, I apologize.
Right. Thank you very much.
None of your business.
Jenny?
Please reserve my right.
John? Rice?
Yes, thank you.
Oh.
My name is John Rice. I live in South Bend. I'm a practicing pediatrician, and I also represent the St. Andre Bessette Guild of the Catholic Medical Association. Our group sent the board a response to the recent statement, and I appreciate the board's attention to that. We respect the professionalism of the board and its role, but we do have serious objections to the statement. The statement contained a lengthy list of areas in which Indiana falls short of meeting the needs of women, children, and families. These are important topics for the legislature to address, not as single issues, but with a comprehensive view of the protection society owes to its most vulnerable members. Specific proposals should be advanced and their economic and social impact assessed through the legislative process. But the inclusion of these issues in a statement about abortion implies that these problems require the availability of abortion as a solution. We hold that the taking of an innocent human life can never be part of the solution for societal issues such as poverty, discrimination, access to health care, or education. From the first moment of its existence, what is conceived is a living human individual, distinct from either its mother or its father, but wholly dependent on its mother for support and safety. The opinion of the Dobbs decision and any embryology text will include many milestones through which the developing baby demonstrates its humanity. The life of this tiny, vulnerable human being has equal value to that of every other person in the world. Its value cannot be diminished by physical defects, developmental potential, circumstances of conception, or the emotional or economic burden that he or she presents. A society which uses such criteria to judge the value of any person's life is one in which nobody is truly safe. For this reason, we reject abortion as a solution to the problems of incest and rape. We strongly support giving the mother who is pregnant in these difficult situations all of the assistance she needs, not only to carry the pregnancy to term, but to recover from the trauma sustained in these events. Abortion in these settings only adds another act of violence against another innocent person. We encourage those societal changes which will make rape and incest unthinkable, so all women can live in safety and dignity. A baby developing with an anomaly which may be incompatible with life outside the womb
10 seconds.
is still an innocent human being and deserves a right to life. That anomaly should not be a death sentence. Thank you, Health Department. I wish you to reconsider the decision. And
Thank you.
Dr. Rice, were there any obstetricians, OBGYNs involved in the drafting of that statement?
yes, there were.
Excuse me, Ellen, we don't interact with the public on public comment.
Oh, okay, sorry.
Jenny?
Maria?
Maria.
Hi, guys. I'm Maria. I live in Mishawaka. This is also my first time coming. I'm extremely nervous, but I am very happy that I'm here. You have all educated me so much today.
What's your last name?
Carmona, Maria Carmona. First, I would like to thank you all for what you are doing. I want to thank you for making everybody knowledgeable of scientific facts and for using medical terms, because this is a medical subject. All mothers here know what it takes to raise a child, and you all know how important it is to make that choice for your body. My children, my mother, my sisters, and I are thankful for your effort and for supporting women. People like my 5-year-old and my 10-year-old, and for taking care of their medical safety. Coming from a woman who has been sexually abused, this means so much for us. I respect all religions and all beliefs, and I'm only asking you to do the same for me. Thank you.
And that's all. So in conclusion of our public comment, I've made this comment a number of times in the past, but sharing of comments like this from both sides of the issue and in the middle of it It's exactly what our democracy is all about. And I thank all of you for being here and sharing your thoughts, whatever they may be. And just as Dr. Crothers expertly said earlier, we're not all going to agree on everything. Gosh darn it. I do appreciate this public comment section when we can come together and have a moment where we just listen. So I thank you all for being here. And with that,
Can I ask a quick question? It's minor. All the correspondence we receive by email from the public, is that going to be entered into the record? The
We don't
minutes?
usually publish them. We can, if you want to make a motion.
I'm just asking. I'm not. Do you think it should be?
did we
don't
talk
typically
about
do
that in our last meeting? Did we talk about that?
I don't remember talking about it.
I don't think so. Talked about what we were going to do with the emails. We'll talk about it.
Okay.
And then we'll put an email out. Marcel and I will talk about it. So the next time and place at the next meeting, August 17th, 4:30, same place. We are adjourned. Thanks, everybody. Were you the one who put on the-
No.